First of all, what this bill does is it abolishes long-term isolated solitary confinement in the Commonwealth of Virginia. No one may spend more than 15 days in solitary confinement during a 60-day period. And whilst in solitary confinement, they would have 4 hours of out-of-cell or out-of-cage time for recreation or some type of exercise. There are a number of sister states that have abolished solitary confinement in the Commonwealth, in our country, and they have been successful. Not only successful in helping those individuals who were in solitary confinement, but the fiscal impact decreased substantially. For example.
Good morning, Madam Chair and esteemed senators. I'm Kim Bobo, Director of the Virginia Interfaith Center for Public Policy. Faith communities are united in their opposition to solitary confinement. Holding people for extended periods of time is torture. They described the practice as torture and violation of Scripture and an affront to God. Hebrews 13:3 says, "Continue to remember those in prison as if you were together with them in prison, and those who are mistreated as if you yourselves were suffering." Virginia needs a policy from the General Assembly that will stop torture and reduce the use of solitary confinement. We urge you to vote for this bill. Thank you.
Solitary confinement is a form of torture as this practice entails caging an individual into a minuscule space while depriving them of basic human needs. Studies have shown that isolation could be mentally and physically taxing since people are restricted from human interaction and mental stimuli. Budgets. In 2013, report from the U.S. Government Accountability Office, the cost of placing people in supermax units was 153% higher than the costs for people remaining with the rest of the prison population. Although saving money is beneficial for Virginia, money should not supersede human worth and humanity.
I'm here as an exception to the rule, but I'm not undamaged. I have nightmares. I'm claustrophobic. I had to quit a job because I couldn't keep going into jails and prisons. It was too much. The PTSD gets to me. This bill is a good bill. It doesn't solve all the problems, but I can tell you solitary confinement exists today in this Commonwealth. It existed when I went into the system in 1979. So I would appreciate it. My wife would appreciate it. The families of other prisoners would appreciate it. And families of potential victims would appreciate y'all supporting this bill and getting it done. Thank you.